But first, two separate emergency calls sending first responders to the Bob Michael Bridge over the weekend to try to stop people from jumping. Good evening and thanks for watching. I'm Eugene Daniel.
And I'm Kimberly Eaton. First responders say it's an alarming trend. Austin Schick shows us how they respond. Austin.
Yeah, Kimberly, Eugene, first Friday afternoon, and then again just 9 hours later, 911 calls brought first responders to the Bob Michael Bridge. Emergency workers say the number of calls like that is climbing, and it's concerning. A dangerous trend over the Illinois River. First responders say they're getting more calls reporting people threatening to jump off of bridges.
A lot of folks think this is the only way out, and those are the folks we want to reach now.
It happened twice last weekend, one of those cases proving deadly.
Unfortunately, if they do jump, then it would be our job to recover them as quickly as we possibly can. Our department as well as Peoria, we both have immersion suits. Our officers can get in the water if necessary.
The number of calls may be increasing, but Fond du Lac Park District Police say their response hasn't changed. For over 20 years, they've been part of the team racing to stop someone from jumping and searching the water for those who do, working alongside other police departments, medics, and firefighters.
The fire department gets called often to people threatening suicide and whatnot. And a lot of times our job is just to be there and listen.
Battalion Chief Jim Bachman says firefighters suspend above the bridge and get as close to the person as possible, trying to talk them down, while divers wait near the water below in case they can't. He says firefighters train to communicate with people in crisis and are in the business to save lives.
It's huge when you get a chance to talk to somebody, listen to what they have to say, let them know people care, and you get them to change your mind.
Now, doctors also say the pandemic is causing an increase in mental health disorders such as anxiety and depression and suicidal deaths. A local doctor says if you need help, to reach out.
The thing to remember about suicidality and thoughts of suicide is that it's not a chronic, lifelong condition. It can be treated, and it's definitely much more transient in nature, meaning it can kind of come and go. But when you're in the grips of it, you've convinced yourself many times that it is the only way out and there's nothing you can do about it, but that nothing could be further from the truth.
Now, Bender says if you or someone you know is feeling suicidal, check on how each other is doing and to call the National Suicide Prevention Hotline at 1-800-273-8255. Kimberly?